Welcome, everyone. Thank you to those who are joining us live, to those who are listening in afterwards. I would also like to warmly welcome our guest today, who I will shortly introduce. As you will all know by now, my name is Catherine Duggan. I'm the Chief Executive Officer here at FIP, and I'm delighted to be with you in our concluding episode of this inaugural transformation programme. Many of you will know that the FIP vision is for a world where everyone benefits from access to safe, effective, quality and affordable medicines and health technologies, never more appropriate than in 2020. FIP mission is to support global health by enabling the advancement of pharmaceutical practices, sciences and education. And this programme is fundamental to our mission. We're pleased to be delivering this Global Virtual Summit, the programme finale, a high-level event in which we will recap the primary outcomes of the 24-event digital series. Together, we will adopt the FIP commitment to action on vaccination in pharmacy, which will be launched during this summit, and global leaders from health and pharmacy will join us at this landmark event. So for the final time in this programme, some housekeeping announcements from us. This webinar is being recorded and live streamed via Facebook. The recording will be freely available on our website, www.fip.org. You may, as ever, ask questions using the Q&A box. We will monitor them through the meeting, but we don't have a specific Q&A session today. You're welcome to provide feedback to us at webinars@fip.org. And of course, we welcome you to become members of our federation. So colleagues, transforming vaccination regionally and globally is the first FIP transformation outcome-based programme of its kind that we have undertaken online. It's underpinned by our FIP development goals. And the final outcome of the programme today is the historic global FIP commitment to action on vaccination in pharmacy. This really sets the pace for us for 2021. And to support that, we will be publishing the FIP Transforming Vaccination Collection early next year. I'd like to welcome the Transforming Vaccination Programme team who are here in front of you on the slide, known to all of you by now, who will help me today by co-hosting this event, a true team in action. First and foremost, Lena Bader, the FIP Programme Lead for Workforce Transformation and Development and the lead for this Transforming Vaccination Programme here at FIP. Arlene Ngoma, Programme Coordinator, Farah Akkad, Projects Coordinator, and Gonzalo Sousa Pinto, FIP Lead for Practice Development Transformation and our Essential Programme Advisor. I'd also like to welcome FIP President Dominique Jourdan, who will be with us today to host the Global Roundtable. Welcome, Dominique. We will hear from you in a few minutes. So we'd like to begin today by reminding you and all of us of why we need to transform vaccination in pharmacy. We will do this by revisiting the global needs and imperatives for doing so. Let's take a moment to remind ourselves of the very first episode of this programme way back in September. There, we fully realised that vaccines are critical to the prevention and control of many communicable diseases, and therefore they underpin our global health security. They are also critical for addressing emerging infectious diseases, for example, by containing or limiting outbreaks or combating the spread of our antimicrobial resistance. So essentially, they are integral to our health. We know that vaccines will help keep an estimated 24 million people from falling into poverty by 2030. A world where everyone, everywhere, at every age, fully benefits from a vaccine for good health and well-being is all of our aims. Immunisation is linked to 14 of the 17 Sustainable Development Goals of the United Nations, a broad set of compelling arguments for the value of vaccines. Now let us listen to some words from Dr. Tedros, the WHO Director General.
Vaccines are among the most powerful innovations in the history of humankind. Up to 3 million lives are saved every year thanks to safe and effective vaccines. But there are still millions of children worldwide who don't receive these life-saving tools. Many have never been immunized. We must not tolerate a world in which a child dies from a disease that can be easily prevented with a low-cost vaccine. Immunization is a building block of strong primary health care and universal health coverage. Increasing vaccine coverage in low and middle-income countries by 2030 would not only save lives, it could also prevent 24 million people from falling into poverty due to health expenses. Immunization is also vital to achieving the Sustainable Development Goals, even those not directly related to health. Vaccines allow people to live full, healthy, and productive lives.
Thank you to Dr. Tedros. So pharmacy-based vaccination and vaccine-related services are linked to 17 of the 21 FIP development goals we launched in September, with a central role in 8 of them, such as development goal number 4, advancing practice and specialization of the workforce is key to delivering vaccination services. Development goal number 7, advanced integrated services is key to implementing and delivering quality vaccination services. Development goal 10, equity in access to vaccination services across all ages. Development goal 16, communicable diseases, the most overtly linked goal, of course, but let's not forget how vaccination is so central for the management of non-communicable diseases as well. Development goal 17, antimicrobial stewardship. Vaccines are absolutely central in strategies to curb and conserve our antimicrobials and curb resistance. And of course, development goal 19, patient safety, which is such an important element in vaccine development and delivery, as we're seeing now in clinical research into COVID vaccines and the vaccination programs that have gone live since the beginning of December. Since FIP signed up to the Astana Declaration in October 2018, we reaffirmed pharmacy's contribution across all our sectors to strengthening global primary healthcare. We also committed to our adaptation of universal health coverage by stating pharmacy leaving no one behind. In this regard, we consider it important to emphasize vaccination for all, from childhood to old age, life course vaccination. And we know in different countries, there are different ways in which pharmacy can make a difference. And we want to support everyone in delivering their role to support their communities, especially children and the elderly. So colleagues, now we need to reflect and remind ourselves of those who've been working on the front line and how important this programme has been and will be for the work they do to ensure all our communities are vaccinated. Remember, we are doing this for the pharmacists and pharmacy workers and for our patients everywhere. Let's hear from some of our pharmacy colleagues and professionals around the world.
I am proud to be a part of the pharmaceutical workforce and support the agenda
to transform vaccination globally, regionally, and locally.
I am proud to be a part of the pharmaceutical workforce,
and I support the agenda to transform vaccination globally, regionally, and locally.
أنا فخورة بإني جزء من القوى العاملة الصيدلانية، وأنا أؤيد جدول التطعيم عالمياً، إقليمياً ومحلياً. شكراً.
شرف لي كصيدلي باش نكون جزء من الصيادلة اللي يدعموا جدول وخطة الأعمال لتحويل التطعيم عالمياً، إقليمياً ومحلياً في بلدي الجزائر.
فخور بكوني جزء من القوى العاملة الصيدلانية، وأشجع فكرة نشر اللقاح عالمياً وإقليمياً ومحلياً.
Me llamo Jaime Acosta y soy farmacéutico comunitario de Madrid. Soy parte del personal farmacéutico y apoyo la agenda para transformar la vacunación global, regional y localmente.
Soy Rosario Cáceres, de España. Estoy orgullosa de formar parte de la fuerza de trabajo farmacéutica y apoyo la agenda para transformar la vacunación a nivel mundial, regional y local.
I am proud to be part of the pharmaceutical workforce, and I support the agenda to transform vaccination globally, regionally, and locally.
大家好，我係香港藥學會會長龐愛蘭 Scarlett。我非常榮幸作為藥劑業嘅一員，我全力支持轉型疫苗注射全球性、地區性同埋本地性嘅議程。
Saya, apoteker Lucy Noviani dari Indonesia. Kami bangga menjadi bagian dari tenaga pelayanan kefarmasian dan kami mendukung agenda transformasi vaksinasi secara lokal, regional, dan global.
ノッティンガム大学薬学部講師荒川直子です。私は薬剤師薬科学者の一員として誇りを持ち、世界で地域でまたはローカルでワクチン接種の変革を進めるアジェンダを支援します。
फार्मास्यूटिकल वर्कफोर्स का हिस्सा होने से मुझे अपने आप पे बहुत गर्व है और वैश्विक, क्षेत्रीय और स्थानीय स्तर पे टीकाकरण वैक्सीनेशन के बारे में जो बदलाव की बातें हो रही है उस विषय में मुझे मेरा पूरा समर्थन है। धन्यवाद।
A proud member of the pharmaceutical workforce, and I support the transformation of vaccination globally, regionally, and locally.
Eu sou Silvana Leite, sou professora e pesquisadora da Universidade Federal de Santa Catarina e eu apoio as ações em prol da vacinação no Brasil e no mundo.
Je suis pharmacien à partir de la République démocratique du Congo. Je suis fier de faire partie de la main des pharmaceutiques et soutiens le programme visant à transformer la vaccination sur l'échelle mondiale, régionale et locale. Merci beaucoup.
Pharmacist. Obi dị m na-aṅụrị ịbụ onye ndị ọrụ ndị ọkammụta ọgwụ n'ụwa niile gbara gburugburu, mana ejike m ohere a na-enye nkwado gbasara ịgba ọgwụ mgbochi nke ndị oyibo na-akpọ vaccination, n'ihi na ọ ga-enyere aka ime ka ahụ anyị dị mma ma anyị bịa ogologo ndụ n'obodo anyị bụ Afrịka n'ụwa niile gbara gburugburu. Ndewonu, ka emesịa.
Я горда быть частью фармацевтического сообщества, и я поддерживаю планы по трансформации вакцинации на глобальном, региональном и localном уровне.
Eczacılık mesleğinin bir mensubu olmaktan gurur duyuyorum ve aşılamayı yerel, küresel ve bölgesel olarak dönüştürme gündemini sonuna kadar destekliyorum.
Hola, mi nombre es Sofía Segura y soy de Costa Rica. Estoy orgullosa de formar parte de la fuerza de trabajo farmacéutica y apoyo la agenda para transformar la vacunación a nivel mundial, regional y local.
Tenho orgulho de fazer parte da força de trabalho farmacêutica e apoio a agenda para transformar a vacinação a nível global, regional y local.
Hola, mi nombre es Eduardo Sabio, soy el presidente del Foro Farmacéutico de las Américas. Estoy orgulloso de ser parte de la fuerza laboral farmacéutica y apoyar la agenda para la transformación de la vacunación a nivel global, regional y local. Muchas gracias.
Ug akong gisuportahan ang pagbago sa imahe sa vaccination sa tibuok kalibutan dinhi sa Pilipinas ug sa akong kaugalingong komunidad.
Wow, colleagues, that was absolutely super. All of our frontline pharmacists and pharmacy workers, you need to know we are proud of you. So, since September, when we launched the first event in this programme, the world has undergone even more changes, perhaps than we had hoped. Let's hear from Gonzalo now on how these have impacted us and the urgency now that faces us to transform vaccination. Over to you, Gonzalo.
Thank you, Catherine. Indeed, this program started on the 25th of September, World Pharmacist Day, and change never stopped, and in the way that this pandemic has affected us, but also the innovations that came along during this period. Can I have the next slide, please? And just to share with you some of the data, this is the number of daily confirmed cases of COVID-19 for all countries around the world. And if we look at the last part of the graph, where the bars for since the day when the program started, we can see that the number of daily cases continue to rise and is expected even to continue rising in the coming weeks or months. Next slide, please. And the same happens with the number of confirmed daily deaths from this pandemic. So the need and the pressure and the urgency for solutions and for joining efforts in fighting and bringing this pandemic under control is very much urgent and needed. Next slide, please. We can see that the pandemic has really gone global. It affects all countries in the world and places a huge pressure on our health systems across the globe. Of course, in some of the regions, we can see that it has been particularly incident or prevalent, but it has really affected all countries, regardless of their income level or their location. And I made this slide a couple of days ago. On Tuesday, it was 73 million cases of COVID-19 globally, and I've just checked a while ago, and we already are close to 75 million. So we can see that the progression of the pandemic is really still of great concern in all countries. But as Dr. Tedros recommended earlier in the pandemic, we need to test, and test. And it's important for identifying positive cases, even when asymptomatic, and also to break the transmission chains. And since the beginning of the year and the pandemic first appeared, and especially in the last few months, we've had also access to new technologies for testing that allow us to test and identify and diagnose cases that need to be followed up or quarantined or treated in a variety of settings, and using different sample collection methods and different technologies for this. Next slide, please. The same happened with vaccines. I mean, never in the history of humankind and health had the world witnessed such a quick effort and productive effort of identifying, developing, and producing vaccines for an emerging disease. And this was possible due to the joint efforts of many partners, universities, governments, industry, and without doing any shortcuts in terms of safety and effectiveness of these vaccines. We managed to now end the year with several vaccines that are ready to be used and have demonstrated their safety and effectiveness. And some of them have already been approved in some countries and introduced in the market. And we have already seen the first vaccinations last week in the UK. Ms. Margaret Keenan was the first person to be vaccinated outside of a clinical trial. And we have seen this happening also in other countries. And just today, it was also announced that vaccinations will start across the European Union on the 27th of December, if I'm not mistaken. Next slide, please. But of course, the need for these massive testing and mass vaccination at an unprecedented scale also puts a great pressure on health systems, and we have to consider the workforce challenges to deliver these tests and these vaccinations. And that's when health systems really need to look at all available resources and professionals that can contribute to bringing the pandemic under control by delivering these tests and these vaccinations. And of course, that's the reason why also we are emphasizing the availability and the readiness of pharmacists to contribute to these efforts together with our colleagues in other health professions. We see these queues of people around the world in various settings. It's the same scene, let's say, of people queuing to get tested and people queuing to get vaccinated soon in many countries. And we really need to harness all available health professions to deliver these. Next slide, please. And we have already started seeing some very positive outcomes of our advocacy and our colleagues in various countries and making themselves available to deliver COVID vaccines. And we have seen, for example, that in the United States, England and Ireland, the engagement of pharmacists or the participation of community pharmacies and pharmacists in general in vaccination against COVID-19 has already been announced and confirmed. And we envision and expect that many other countries will use the potential of pharmacies to in their vaccination strategies. Next slide, please. And back to you, Catherine. Thank you.
Thank you so much, Gonzalo. So now I'm going to hand over to Lena. And Lena, you're going to take us through the program, the 24 events to today, and see what we have delivered. Thank you, Lena.
Thank you, Catherine. Thank you, Gonzo, for that introduction. Very emotional to be at the 24th event, and I know many of you with us in the participants list have been in the previous events. So we want to take this journey back with you from September through to December and see what we delivered together. So together with my colleagues Farah and Carleen, we're just going to run through the 3 series of the program and share some of the key outcomes and aims from each one. So just as a roundup, Catherine's already mentioned that this is the first outcome-based transformation program by FIP. It's a series of 24 events delivered through 3 series. The first one focused on identifying transformation needs across practice, science, and workforce and education. The second set of 8 events forming the second series focused on setting transformative goals and looking through the lens of the FIP development goals to identify mechanisms for transforming vaccination. And the third and final series, which we are concluding together with you today, is all about committing to transformation and identifying regional needs. Without further ado, let's look at each series in a little bit more of a breakdown. I'm going to invite my colleagues now. They have contributed some videos. Some of you may already be familiar with them, and I'll introduce them shortly, who actually are going to be providing the summary. So just as a reminder, we looked at practice science and workforce and education. It was really important to have a global overview of the needs and considerations for transforming vaccination globally across these 3 areas. Since the launch of the FIP development goals, our motto and mission to operate as one FIP and look at the three areas together has been a priority, and we have implemented that straight away through the Transforming Vaccination program. So we have with us here today a summary of the practice components. Emma Paulino, the professional secretary of FIP, who has co-moderated and led the practice components of Series 1, has sent us a short video to tell us what the aims were. Let's watch.
The goals of practice sessions in Series 1 were to outline the path taken to achieve successful vaccination programs by pharmacists in different countries and jurisdictions with existing pharmacist vaccination, also to define and quantify the workforce development needed to empower pharmacists to deliver successful vaccination programs, and to define and quantify the barriers that prevent pharmacists from contributing to vaccination. Based on the discussions, we developed a practice development toolkit to support members of the world in this endeavor.
Thank you to Emma for this excellent summary.
The goals of
For the science components, we've invited Giovanni Paletti, the scientific secretary of FIP, who, similarly to Emma, has supported us in leading the science components of Series 1 and helped us identify some imminent needs in the area of science and vaccination. Let's hear from Giovanni.
Hello. The aim of the science sessions in Series 1 was to define and quantify the barriers that contribute to low vaccination rates, but can be addressed by pharmacist vaccinators who understand vaccine development from the initial steps in research through widespread use in a diverse population. We achieved a scientific review of safety and efficacy assessments during vaccine development and discussed resources that provide myth-busting evidence to reduce vaccine hesitancy.
And thank you to Giovanni for that contribution. Last but not least, let's look at the workforce and education components of this program. And to help us do that, we have a contribution from Professor Ian Bates, the Director of the Workforce Development Hub and member of FIP Education Executive Committee.
We're recapping what has been achieved in Series 1 of the vaccination program delivered by FIP. We were looking at initial education and training for future generations of pharmacists, but we were also looking at the workforce as well, continued education and development of that workforce. I think we achieved what we set out to do. We've defined competencies, and within those competencies, we have foundational knowledge and education, and we also have a good idea of what training and development is required. So we are developing and will launch our guidelines for both initial education and training of pharmacists and for our existing workforces in terms of workforce development. It's a huge success and a huge achievement globally for everyone who's contributed to this series.
Thank you to Ian, Emma and Giovanni, who have really been instrumental alongside other colleagues from FIP in helping us deliver the aims and objectives of Series 1 and come out with outcomes and priorities that we'll be sharing later today on what FIP will be committing to do to address those emerging needs. We'll move on to Series 2, and for this one, I'll actually be inviting my colleague Carleen, Program Coordinator for Transforming Vaccination Globally and Regionally, to share some of the key outcomes and aims of this program. Carleen, the floor is yours.
Thank you, Lena. Series 2 of the Transforming Vaccination Globally and Regionally program was about action. We took the needs that were identified in Series 1 and discussed the actions that we need to take in alignment with the FIP development goals to address them. Series 2 discussed the mechanisms and drivers that will progress the FIP development goals in the context of transforming vaccination in pharmacy, addressing training requirements, policy development, evolution of existing health systems, equity and access to health resources, patient safety, and medicine stewardship principles. On the next slide, we looked through the lens of the FIP Development Goal 4, Advanced and Specialist Development. We discussed the processes required to take vaccination by pharmacists from a specialized field that few pharmacists deliver in some jurisdictions to a standard part of pharmacist care in all settings and locations. We discussed the pioneering work that has been made in countries around the world where vaccinations are provided by pharmacists, how this was achieved, and what steps need to be taken to normalize pharmacists as vaccinators. On the next slide, the second goal was the FIP Development Goal 7, Advancing Integrated Services. We discussed change management principles in the context of integrating advanced practice services into everyday practice, ensuring that vaccination by pharmacists in all settings and jurisdictions is consistent with best practice and practice guidelines. Where a pharmacist is present in all settings, vaccinations can be provided, ensuring collaborative work and shared documentation with all healthcare professionals to ensure it is an integrated service. The next goal, through FIP Development Goal 13, Policy Development, we discussed the process of policy development, identification of barriers, and engagement with stakeholders to ensure that pharmacist vaccination is accessible to all people in all settings where pharmacists work. We deconstructed vaccination through FIP Development Goal 16, Communicable Diseases. We discussed communicable diseases from the perspective of vaccination by a pharmacist, including the role of vaccination in the prevention and suppression of communicable and vector-borne disease, and the promise of addressing these diseases that pharmacist vaccinators will deliver. FIP Development Goal 17, Antimicrobial Stewardship, is another core goal we discussed. We discussed the role of vaccination in antimicrobial stewardship, preserving antimicrobial effectiveness, preventing antimicrobial resistance, and the promise of addressing these issues that pharmacist vaccinators will deliver. Together, we explored FIP Development Goal 18, access to medicines and services, and FIP Development Goal 10, equity and equality. We discussed the role of pharmacists in ensuring that vaccinations are widely and easily accessible by all people in all areas of the world, and the expertise of pharmacists in delivering the logistics and services needed to increase vaccination rates. We considered all safety aspects through FIP Development Goal 19, patient safety. We discussed the role of pharmacists in delivering safe vaccinations, participation in vaccination monitoring and adverse event reporting, and the role of improving vaccination rates as a method of reducing overall harm caused by preventable disease. We concluded Series 2 with a summary event that brought together the topics and issues discussed throughout Series 2, how they met the needs raised in Series 1, and how this sets the stage for Series 3, where we examine the context of transforming vaccinations globally and regionally within 6 global regions. All of Series 2 events are still available to view at the Transforming Vaccination website, and we hope that you're inspired to visit the site and watch these videos as a first step to transforming vaccination in your practice, and with the FIP, transforming vaccination globally and regionally. And now I'll hand back to Lena.
Thank you very much, Carleen, for that excellent summary and for reminding us again that all of the event recordings, the information, resources available for free on transformingvaccination.fip.org. So if you did not catch all of the 24 events, we do recommend that that's a plan for you to consider over the coming holidays. So without further ado, Series 3 summary, I'm actually going to be inviting my colleague Farah, who is the projects coordinator for this program, to again walk us through what happened in Series 3. Farah.
Thank you, Lena. Good morning and good evening, everyone. We're very delighted to have you with us today. Series 3 of the Transforming Vaccination Globally and Regional program focused on identifying needs and drivers for transforming vaccination from a true regional perspective. We discussed the progress made in each of the 6 world regions with regards to pharmacist vaccination, the quality and universal access to vaccinations, barriers, challenges facing all countries, and the regional needs for future transformation. In each regional event, countries were able to share resources and interventions which were adapted to expand the pharmacist role in vaccination. Series 3 shared lessons learned from different countries in the region that achieved a transformation and can help to drive change in the enforcement of the greater role of pharmacists, which is in the most important key area of healthcare, vaccination. As shown in the next slide, Series 3 started with Europe, where we showcased country examples such as Belgium, France, Malta, Turkey, among many others. In addition to understanding the perspectives of regional organizations, including Pharmaceutical Group of the European Union and the European Healthcare Distribution Association, GERB. We were also joined by an esteemed guest, the technical officer from WHO Regional Office for Europe, Niyazi Shakmak, who expressed support to the agenda on vaccination in pharmacy. And I will mention one important quote from Dr. Niyazi, which says, "The provision of vaccination services should not be considered in terms of public or private sector perspectives. The major driving issue is public service. In that sense, pharmacies provide a public health service. That is how community pharmacy concept is built on." The next event covered is Southeast Asia, where we showcase country examples from India, Sri Lanka, Thailand, and Nepal. We were also joined by an esteemed guest, the regional advisor from the WHO Regional Office from Southeast Asia, Manisha Shredar, who presented about the role of pharmacy professionals in vaccination for the COVID-19 context. And she expressed strong support for the role of pharmacy and offered strategic recommendations to support the agenda on vaccination in pharmacy. We continued our journey in the next event with the Eastern Mediterranean region, where we had countries representing Jordan, Lebanon, Egypt, Pakistan, and Yemen. We were also joined by an esteemed guest, the technical officer from the WHO Regional Office for the Eastern Mediterranean region, Dr. Adi Nusayrat, who expressed strong support also towards enabling other agenda on vaccination in pharmacy. And he mentioned that pharmacists' role as healthcare practitioners expands to include building public awareness, counseling, and administration of vaccines. Next, we reviewed the Western Pacific regional perspective, where we showcased country examples such as Philippines, Australia, and Hong Kong. And in the next regional perspective, it focused on Africa, which included Cameroon, Ghana, Algeria, and Kenya. Last but not least, the final regional event ended with the Americas region, where we showcased country examples from Panama, Argentina, Paraguay, Ecuador, and Uruguay. Following those 6 regional events was the 7th episode entitled From Regional to Global, Common Priorities for Action to Transform Vaccination. It took place earlier this week, a roundtable which brought back all the key outcomes from all the regional discussions into one roundtable, aiming to identify barriers and common priorities for action to transform vaccination. We will shortly hear from the Global Roundtable lead, which is led by Dominique Jordan, the president of FIP. It's worth mentioning again that Series 3 events, recordings, and slides are available on the Transforming Vaccination website. And to wrap up today, we invite you to commit to support the agenda to transform vaccination globally, regionally, and locally. Thank you, and over to you, Lina.
Thank you very much, Farah, for that summary and overview. And with that note, we'd like to pause and explore a little bit more in depth what the regional priorities and outcomes are. And for this, I'll be handing over to our FIP president, Dominique Jordan, who's going to be chairing a short global roundtable where we can hear directly from the regional leaders. Dominique, the floor is yours.
Thank you very much, Lina. Welcome everyone to the President's Roundtable. But before I start, I just want to tell you how proud I am to be first pharmacist and secondly to be president of our federation. I have many reasons to be proud, but I just want to mention 2 reasons. The first one is the work done by all the people involved in this program is fantastic. And the outcomes is also one of the most impactful outcome that I ever saw. And the second reason is when you consider the videos that we had, having so many colleagues all around the world committed and supporting our effort to push forward the vaccination all over the world, and having this support is an excellent thing. Just remember, FIP will be with you and supporting you and will be beside you to make you an important or a crucial actor in vaccination and beyond. So back to my global roundtable. We have invited regional leaders to share with us the key priorities for transforming vaccination that are emerging from each region. Let's start with Europe, where we are joined by Stephanie Cole. She's the Policy and Advocacy Officer, the European Association of Hospital Pharmacists. Welcome, Stephanie. Stephanie, please, could you share us the key priority areas for Europe?
Thank you so much, Dominic, for giving me the opportunity to report back from the exchanges we had during the event of the European region, which brought together pharmacists, academia, full-service healthcare distributors, and the WHO Regional Office for Europe. Our discussion showed that a lot of good progress is being made in several countries in Europe, such as, for example, France, Ireland, and the UK, to just name a few. Our discussion centered a lot around flu vaccinations that are being offered by pharmacists across the European region. However, to ensure that the entire region benefits, further efforts are needed that help with promoting the best practices of the frontrunners. Pilot projects are a great opportunity to showcase to national decision makers the added value of involving pharmacists in the provision of vaccination services. But the experiences from the countries that have already undertaken such projects need to reach all countries across Europe and also all individual pharmacists that are looking at transforming their vaccination services at national level. Also, education and training were identified as key components for both community and hospital pharmacists, since they are important actors in making vaccines and vaccine information available to the public. The third and last aspect that was addressed during the discussions that we had with different representatives from the European region was collaboration and the engagement with other healthcare professionals and stakeholders. It was agreed that transformation can only be achieved by all countries across the European region if sufficient support for vaccination services delivered by pharmacists in pharmacies is gathered from patients, citizens, other healthcare professionals, and national competent authorities, since pharmacists cannot achieve the transformation of their vaccination services all by themselves. Back to you, Dominique.
Thank you, Stephanie. Moving on to Southeast Asia. G. Sumalata is the Executive Committee member of the Southeast Asian Regional Pharmaceutical Forum, and she joined us today. Suma, the floor is yours.
Hello, Dominic. Hello, everyone. On behalf of our CRFORM Forum, what is required to transform vaccinations in the CR region is as follows. Like, pharmacists are not authorized to vaccinate, but involved only in store, maintain, cold chain, and supply vaccines against prescription in the most countries. Advocacy is needed to ensure a legislation authorizing pharmacists to administer vaccines and under some circumstances to prescribe vaccines. Advocacy by the Indian Pharmaceutical Association and timely support by FIP resulted in a government notification listing pharmacists as vaccinators along with other healthcare workers. Authorized pharmacists in CR countries need training to develop and the required skills to become competent vaccinators. FIP to play a huge role to train and equip these pharmacists to be competent vaccinators who can store, administer, under proper advice, monitor safety, and manage vaccine supply chain and waste disposal. Thank you, Dominic. Thank you for giving me the opportunity.
Thank you, Suma. I'm sure we will help you, we will support you, and this will be a success story at the end.
Thank
you. The third region we will discuss is the Eastern Mediterranean. Nadia El Mazroui, President of the Eastern Mediterranean Regional Pharmaceutical Forum, is here with us today. Nadia, please, can you share with us the 3 priority areas emerging from the Eastern Mediterranean region?
Thank you, Mr. President. Sure, it is my pleasure really to be here with you and sharing this needs of our Eastern Mediterranean region to be involved with FIP in the vaccination program, which is badly needed in our countries. Really, delivery of vaccination services faces always unique barriers in many countries, but issue with legislation, logistics, and resistance from other healthcare professionals are common issue across the region, our region. And we found that if we are going to make a lobbying decision maker with legislator, including the involvement of international organizations like FIP and WHO to support the position of local pharmacist organization, also creation of guidelines for vaccination by pharmacists, frame for pharmacist role within the health system, and accredited training at the same time as point 1, so that the pharmacists are qualified and ready to contribute moment the legislation catches up. Inclusion of international organization will give us a power like WHO, UNICEF, and FIP in the process of lobbying decision, and development of the training was a consistent theme and need. Addressing positions for others within the healthcare sectors is an important part of removing the barriers. Also, we find that to ensure undergraduate courses includes vaccination training, provide postgraduate training for vaccination, development of guidelines, as I said, and framework for vaccine delivery. Lobbying for decision is a critical, with decision makers, is a critical activity and should be accompanied by development of training guidelines and framework vaccine delivery to ensure that decision maker can see the evidence of pharmacists being qualified to deliver vaccination. Thank you very much, Mr. President, and thank you for your effort and the FIP to really transform, and it is a great transformation in the vaccine in the pharmacy profession in our region. Thank you very much.
Thank you very much, Dr. Nadia. But don't forget, this work can only be done if you are working on it with us, so that it will be an excellent collaboration. Thank you very much.
Thank you.
Now from the Western Pacific, John Jackson, President of the Western Pacific Pharmaceutical Forum, has sent us his reflections and outcomes from the regional event. Let's hear from John.
Good afternoon, or in my case, good evening. I've been asked to present 3 key issues arising in countries of the Western Pacific region regarding transforming vaccination in pharmacy. Like other regions, the Western Pacific region is very diverse. Pharmacists have been administering vaccines in a small number of countries in the region for about 5 years, but it's still a long way off in other countries. So my comments are a consolidated reflection of the region, not of any one country. The 3 key issues I want to raise are, firstly, the need for a sound public health argument for expanding access to vaccination. Secondly, convincing regulators that pharmacists are a very, very important player in addressing the need to increase access. And thirdly, creating a comprehensive strategy for changing policies, regulations and laws to enable pharmacists to independently vaccinate. I'll speak to each of these issues now. No country has the level of vaccination as high as they would like it to be. The sound public health argument for expanding a country's vaccination capacity should highlight the problem of the limited access to existing vaccination services that are provided by doctors and nurses. Getting access is difficult for those people who are of an age that they do not regularly need medical care, so do not see doctors very often. It is difficult for those people who work hours that make it difficult to visit doctors. And it's difficult for those people who live in areas where access to doctors is limited. Pharmacist vaccinators will be more readily available to these and other groups and will boost the portion of the population who can be vaccinated. And we need to emphasise that pharmacist vaccinators will in fact increase the size of the vaccination market rather than take patients away from doctors and nurses. The second task is the need to convince regulators of this public health reason and provide them with the guidance and support needed for them to withstand the pushback that is likely to come from doctors and nurses. And this is where advocacy by FIP, the regional pharmaceutical forums and other multinational agencies can be very helpful. The third task is creating a comprehensive strategy for the changes in policy, regulation and law that will be needed for pharmacists to vaccinate. These include, for example, laws that permit pharmacists to administer vaccines, laws that give pharmacists access to vaccines for the purpose of administration, standards of training and quality control, processes for record keeping, and the types of facilities that will be required by pharmacists. So in summary, the hardest part will be defending against other health professions what should in fact be an irrefutable argument. The easy part will be educating and certificating pharmacists and facilitators. Thank you for your attention.
Thanks to John for his participation. And from the African Pharmaceutical Forum, the President Prosper Yag joined us today to give us the African perspective. Prosper, please go ahead and share with us the outcomes and regional needs from Africa.
Thank you, President. Thank you, Jordan, for your interest for Africa. First of all, what I would like to say is that Africa is committed is engaged in the process of transforming vaccination globally, regionally, and locally. But at this level, there is a few countries that are already vaccinating, where pharmacists are already vaccinating. The number of countries should increase, should be developed. We have to expand vaccination all over our continent. For that, we have to work really close to the policymakers, the regulatory makers. We have to work with, we have to do advocacy. Advocacy is important. For that advocacy, we'll need the support of FIP. The support, I know the support is already there. The letter of the president has come. We convert the letter in our letter to our ministers. Education is also important. The pharmacy should be educated to vaccine. They need to increase their competence. They need to increase their competence initially and with continuous education. This is also very important. We will face barriers, psychological barriers, cultural barriers. We have talked about them. We have to work with communication, with good communication to people, to the population, to know that vaccine is not something which will reduce the fertility of young girls. We have to work on that also. I think at the end, we need to work with WHO, because in our countries, the role of WHO is fundamental to define health policies. In working with WHO means that pharmacists will be part of the transformation, will be part of the health system, will be important in the health system, in the health policy, and vaccination is something, it's a priority in our country. Finally, we'll need means to do that, because vaccination should not be considered as something free in pharmacies. We need a bit of remuneration, even though we are doing public service. Finally, I would like to conclude by saying this: the support of FIP for Africa is important in the relation with WHO. Some countries have already begun making some big effort: Algeria, Ghana, Kenya, some people, some like my country, but we need together to move forward at the same time. We need the support of FIP to do that. We need the support of WHO to do that. Thank you.
Thank you, Prosper. And I'm happy to collaborate with you and my African colleagues on this issue in the next few months.
Thank you.
Last but not least, we will hear the perspective of the Americas region from Eduardo Savio, President of the Pharmaceutical Forum of the Americas. Eduardo, the floor is yours.
Thank you, Dominique. Good morning from the Americas. We are very proud for being part of this important initiative, and our gratitude, the gratitude of the Executive Board of the Pharmaceutical Forum of the Americas, to all FIP team.
I would like, based on the priorities that were detected, I would like to share with you and with everybody all the three main next steps. We have a publications that gathers all the recommendations customized for the Americas regions, as well as the experience that has been developed in terms of immunization services that will be launched at the beginning of next year in Spanish, in Portuguese, and in English. By the middle of January, we will be establishing the group, the working group, to support all the countries that would like to move forward in different process in terms of establishing immunization services. And so we will work together with FIP to develop a specific country strategies in order to move forward. And third, in terms of education, we have a dream. The dream is that every pharmacist in the region of the America would have the certification to participate in vaccinations with the same training programs. We are, in terms of arriving to an agreement to use the program of the American Pharmacists Association to translate it into Spanish and into Portuguese, and to have a series of webinars in order to have the capability of delivering this program through a series of webinars customized to the way, to the culture, and to the way of thinking of the region in Spanish and both in Portuguese. So we are happy really to be part of this process and to support FIP and to support the region of the America in transforming globally and specifically regionally the vaccination. Thank you very much for this opportunity, Dominique.
Thank you, Eduardo. I am sure your dream will be a reality in a few months, because the strategy 1 FIP will help you and help our colleague in the American region to make your dream reality. Thank you very much. And thank you also to all regional leaders for their insights and support in this program. We will work with regional to do regional mapping and identify priorities for actions moving forward. I want to make you some personal reflection now. And I'd like to highlight 3 key issues that are also important for pharmacy in the area of vaccination. First is sustainability. With the COVID-19 pandemic, we have the opportunity to try to be active in vaccination, and this is a good thing. But we have also post-pandemic to keep on vaccinating, and this is very important. This sustainability is, for me, the best example how science, education, and practice come together. Without a good education, we can't assure the safety of patient. And if we don't have the safety of patient and good product for also the safety of patient, our services will not be sustainable. It's the reason why this sustainability should be one of the key issues with education, science, and practice together. The second thing is to assure the sustainability, as Prosper said before, is the remuneration. Pharmacist has to be remunerated for the services that he provides. And this will be also a very important part of the advocating from FIP, that the pharmacist will be remunerated for vaccination. And the third one is the pricing. As you know, we have a development goal 10, equity. And equity, it's not only a gender equity, but it's also equity from countries, so that we have developed country or economic powerful country, and we have country who couldn't afford to pay the price for vaccine. And I know that WHO is considering this aspect, and we will collaborate with WHO to have this issue fixed in the few next months because of the COVID-19 pandemic. But this is also a priority for us to decrease the gap that we have between the countries. So that, once again, thank you very much for your commitment to FIP, your commitment to the program, vaccination program. And I am pleased to see that we have attendees today from all the region of the world. I don't want to name one of the region or the other one because I will not be able to mention all of them, so that it's a great success for me to have the opportunity to speak or to present to all our colleagues all over the world our vaccination program. Thank you very much for your attendees. And I want now to hand over to Catherine and invite her to share her reflections to what we heard in the Global Roundtable. So CD, I will give you the floor now.
Thank you so much, Dominique. And thank you so much for chairing that invaluable roundtable with all the presidents of our forums. A great success. So what I wanted to do is offer you a few reflections really on the advances since September, the challenges facing so many of us today, personally and in our families and in the weeks ahead, and the regional priorities we see emerging. I thought it would be useful for us to just take a moment to consider what traits are needed for us to address the changing global situation. So we've been living with the pandemic for quite some time now, and now we move into a next phase where we have to, instead of react, we have to be proactive. And where we have seen success in specific countries, we've seen leaders who've taken time to provide clarity in their messages. They've taken care to set out timelines and what will influence the decision-making at key stages, and that the country and the country people feel involved, and how those decisions will be made, what evidence will inform those decisions. In those countries, we've seen preparedness, we've seen collaboration, we've seen collegiality, empathy, understanding of the impact of the decisions that the state is making on the individuals and the families and communities. But I've been reflecting as I've been listening today, and when we saw our wonderful professionals saying how proud they are to be part of our profession, I would say, colleagues, that we cannot leave leadership only to those in positions of power. We all need to lead in our own ways. We need to lead by example, we need to lead with humility, and we need to lead with evidence. We are scientists and we are part of our communities. And this is what we need from each other. And this is actually what we need from ourselves. So we're watching some of the chat today, and I have to say, you are all the leaders in our profession. And when you watch our round table, you watch our president, you watch all of the profession stepping up and stepping in. These are the traits we need from each other. I feel we have these traits in each other. I'll have the next slide, please. So we're so proud now to present the key outcome of the programme on the 24th event of the programme, the FIP commitment to action on improving vaccination coverage through pharmacies, which lists 11 key commitments to transforming vaccination globally and regionally, which builds on the call to action we have made earlier. Firstly, pharmacists, pharmaceutical scientists and pharmacist academics will commit to improving healthcare outcomes with regards to access, equity and quality by delivering the safest possible vaccines and vaccine-related services in the form that is most acceptable to healthcare consumers by all pharmacists in all settings. Second, pharmacists will contribute to expanding vaccination pathways, especially for adults, in all countries with the goal of increasing vaccination coverage globally, regionally and locally in line with our development goals. Thirdly, Pharmacists and their organisations will strive towards equity of access to disease prevention interventions, including vaccination, regardless of age, regardless of gender, income, location, ethnicity, or any other demographics or factors, leaving no one behind. Fourth, pharmacists will integrate the delivery of all vaccinations into their practice in all settings, in collaboration with health systems and authorities, other healthcare professions, and education and training institutions. Fifth, pharmacists, pharmaceutical academics, workforce planners, professional regulators will evolve undergraduate qualifications, workforce development, and professional regulations to ensure and maintain ongoing capacity, both professionally and logistically, and the competence by pharmacists in all settings to administer vaccines, to provide vaccine-related services, to provide what their communities need, ranging from supply to community education and awareness. Sixth, pharmaceutical scientists will strive to improve vaccine uptake by developing vaccines that are efficacious, safe, practical to supply, and deliver and acceptable to healthcare consumers. Seventh, pharmacists and their organisations will advocate for legislative frameworks that provide the regulatory assurance of pharmacist-delivered vaccination services and define the conditions, the criteria, and accountability for this activity as part of pharmacists' scope of practice. Eighth, pharmacists and their organisations will contribute to building vaccine confidence by addressing vaccine hesitancy, concerns, misinformation, disinformation, ensuring that all people have access to reliable information and evidence-based advice about the safety, efficacy, and value. Pharmacists will support ongoing antimicrobial stewardship by providing the highest level of vaccination for preventable diseases in all settings. Ninth, pharmacists will collaborate with other healthcare providers to ensure the local workforce is best utilised to ensure maximum vaccination utilisation and coverage, while striving towards the autonomy of vaccination providers to deliver vaccines as agreed per protocol and criteria. 10th, pharmacists and their organisations will advocate for appropriate funding models for vaccines and vaccination services that ensure equity of access for all at the point of delivery across all vaccination providers. And 11th, FIP commits to increasing vaccination by empowering pharmacists in delivering vaccination services, strengthening undergraduate qualification in the area of pharmacist vaccination, addressing legislative and regulatory barriers to full pharmacist participation in vaccination delivery, and ensuring pharmacists have access to shared records that facilitate collaborative healthcare and vaccination service delivery. Colleagues, we know the above measures that I have just read out to you are urgently needed to ensure equitable access to vaccines and vaccination services to people around the world. We know this. Without vaccination programme for COVID-19, we are not going to be able to meet face-to-face and travel as we used to, or even engage in usual activities. But we need this to be available across all ages, leaving no one behind, to reduce the burden of vaccine-preventable diseases, and so that pharmacists can play an even bigger part in the fight against emerging diseases. In addition, pharmacists and member organisations will commit to drive previous FIP undertakings, including our call to action to expand the role of community pharmacies in vaccination. The full commitment can be seen online and includes an additional section that serves as the operationalisation of the commitments to deliver the development goals. So we have two versions, a summary version and then a way in which we can deliver this. And on behalf of FIP, and you've heard the words of Dominique, our FIP president, he and I commit our federation to deliver what we have laid out. We ask all of you, all of our members, all our member organisations to endorse and support it. And the website you can find it on is transformingvaccination.fip.org/commitment. We also have the full support of the FIP boards and FIP Ed and our colleagues in their early careers. Let's start with words of support from FIP in terms of workforce and education. We support the transformation of vaccination globally and regionally through the improvement of policy development, advancing integrated services, advanced and specialist development, communicable disease management, antimicrobial stewardship, equity and equality to medicines, devices and services, and patient safety by the advancement of the pharmaceutical workforce, all to enhance patient care and health system deliverables, all relevant to social determinants of health and needs-based approaches to workforce development, to ensure safe, equitable and equal access to vaccinations by all, based on the needs of the regions and the needs of the nations within. Let's now listen to Paul Sinclair, the chair of our Board of Pharmaceutical Practice, and hear his words of support.
We support the program agenda for transformation of vaccination globally and regionally through the improvement of policy development, advancing integrated services, advanced and specialist development, communicable disease management, antimicrobial stewardship, equity and equality of medicines, devices and services, and patient safety by providing frameworks and infrastructures for people-centred services. This integrated healthcare system is based on interprofessional and cross-setting work to enable equitable and equal access for all to vaccination, whilst ensuring quality assurance and legislation and regulation.
Thanks, Paul. Let's now listen to Ross McKinnon, chair of the FIP Board of Pharmaceutical Sciences, for his words of support.
We support the transformation of vaccination globally and regionally through an agenda involving improvements in policy development, advances in integrated services, advanced and specialist development, communicable disease management, antimicrobial stewardship, equity and equality in access to medicines, devices and services, and a focus on patient safety. All of these advances will be supported by innovation and expertise in the pharmaceutical sciences. By utilising scientific strategies to evaluate expanded professional pharmacy services and programs, and through the advancement of drug safety science, we can ensure equitable and safe access to vaccinations for all.
Thank you so much to Ross. Let's now listen to YPG, represented by Renly Lim, who is the incoming president of the Young Pharmacist Group.
We support transforming vaccination globally and regionally through the improvement of policy development, advancing integrated services, advanced and specialist development, communicable disease management, antimicrobial stewardship, equity and equality to medicines, devices and services, and patient safety. We support the program for the future of the profession by empowering and enabling young pharmacists and students to see the potential of pharmacy vaccination and the opportunities that exist beyond the present to ensure equitable, safe, and fair access to all to vaccinations. Thank you.
Thank you so much to Renly, to Ross, to Paul, and the words from Ralph from FIP. We're all in this together, colleagues, and I think that shows the solidarity that Dominique has always asked us to demonstrate. So now I ask Gonzalo to run through our recent work that will help us with delivering the commitment. Over to you, Gonzalo.
Thank you, Catherine. You may be familiar with several of these resources that FIP has developed to support our member organizations and pharmacists around the world in achieving vaccination authority and rights, and also or expanding it for those countries that already have it. So in September 2019, we issued the FIP Global Vaccination Advocacy Toolkit, especially designed to support our member organizations with guidance on how a variety of countries have achieved these authority and evidence of the impact of pharmacists' work in vaccination and other resources. We continued earlier this year, also in 2019, we joined this coalition with other organizations that have a focus and advocate together with FIP for a life course approach to vaccination strategies. And earlier this year, around March, we issued the manifesto of this coalition. Also in this year, the WHO finalized the vaccination agenda, the immunization agenda for 2030, so for the next decade. And FIP actively contributed to this document as an organization in official relations with WHO. We were invited to review the document, the drafts, and participate throughout the various stages of developing this document that will come into force in just a couple of weeks at the end of this year. In June this year, we published a version that is accessible to all practicing pharmacists and individuals around the world of the advocacy toolkit, including some guidance on how to develop a service at the pharmacy level for a vaccination service. Includes also the evidence of the impact of pharmacists, and also other practical requirements and guidance, as well as other resources that can be used by individual pharmacists when developing such a service. Throughout this year, and in addition to this present series of events, we also organized a parallel series of events that started in July and will end in January 2021, focusing on expanding immunization or vaccination coverage through pharmacists that covered a series of issues from vaccine confidence to policy barriers and other drivers, and a number of other issues, including speakers from the WHO, from the International Federation on Aging, the European Patients Forum, the Pharmaceutical Group of the European Union, and many other organizations that have collaborated with FIP. In August, we launched the report from the survey that we conducted to our member organizations on the roles of pharmacists in vaccination. So the findings from this survey were published in this report and at a special event. And this report includes interesting data, for example, that we now know that at least in 36 countries worldwide, pharmacists are already authorized to vaccinate. And in an additional 16 countries, a legislation is being considered to introduce this role by pharmacists. Also, as has been mentioned by other colleagues and speakers before me, FIP introduced in September the FIP development goals, and particularly we focus on goal 16, which is the one that is most overtly linked to vaccination. But this, of course, provides a framework to also guide our work and to support the work of our member organizations in developing this important area of pharmacists' practice. In September, also, on the first event of this series, actually, we launched a call to action to governments and to other stakeholders to harness the accessibility and the expertise and the knowledge and the potential of pharmacies around the world in expanding vaccination services, especially in relation to the COVID-19 pandemic and any other future pandemics. More recently, only a few days ago, earlier this week, FIP sent to our member organizations a template letter addressed to their Minister of Health that our member organizations can customize with their logo and co-sign together with the president of FIP this letter that is addressed at health authorities, again advocating for governments to harness the potential and the accessibility of pharmacists and pharmacies in delivering mass vaccination strategies against COVID-19. And finally, and last but not least, of course, FIP organized this historical series of events over the past 3 months to share a series of best practices, drivers, concerns, barriers, analyze the needs, and identify the drivers for expanding vaccination through pharmacists globally and regionally. Thank you very much. Back to you, Catherine.
Thanks very much, Gonzalo. So, colleagues, you have the commitment of the Federation from myself, from President Jourdan, the chairs of the boards, FIP Edge and YPG. But the next question would be, what can we do to support you and your countries? So over the past 24 events, we've managed to summarize these into 6 key points, immediate key points, should I say. Firstly, countries can support each other, their experiences in addressing policy, workforce readiness, logistics, acceptance of pharmacists as vaccinators. The FIP Advocacy Toolkit will assist countries to learn from each other with the country case studies there in their journey to pharmacy vaccination. There's nothing like learning from your colleagues to help you take some of the fast tracks. Secondly, quality education and training is a highlight of all of our discussions, and hopefully this answers one of the questions from Guher we noted in the Q&A box in the throughout the session today. As identified in Series 1, a framework that describes undergraduate training needs, the postgraduate continuing education needs, and a clear demonstration of competence by pharmacists as vaccinators will be an essential part of the path forward. And we will assure the quality of training so that all pharmacists have the confidence to access these courses. We won't be competing with the providers that are out there, but we will be providing a platform for those that provide good quality education and training. The third key point was logistics. And this is especially highlighted by the cold chain requirements of vaccinations, especially the new COVID-19 vaccination that has special handling and storage requirements. Again, this point will be supported by the outcomes from Series 1 of this transformation programme. Fourth, FIP commits to working with other health professions to address the barriers they have maybe put forward. This has already worked effectively with our colleagues in the World Health Professions Alliance, the International Council of Nurses, and the International Federation on Aging, a separate agency, to address these barriers and really to get others to advocate for the place of pharmacy. The fifth initiative will be guidelines and support. We look forward to working with countries that have already pioneered this work and how we can apply this to other countries, building from the great efforts they have already made in this space. Last but not least is advocacy. You needed awareness and lobbying and showcasing based on evidence and not self-interest. Evidence of the impact of pharmacists when they become part of the vaccination programme in a country, the impact they have through greater access for all patients and the public. And we will stand by you in this area. We've already worked in this area, as Gonzo said. We created a letter for the Minister of Health in your country, which was launched this week. Let me remind you that this letter is to be co-signed by the FIP president and the president of the member organisations in each country, collaborating if there's more than one organisation, demonstrating them to the Minister of Health, the Ministry of Health, that pharmacists are ready and willing to help however they can, and that there will be training to support the pharmacy profession so that no one need worry about the quality. So we need to thank and acknowledge absolutely everyone. As Dominique has said, there is no one in this programme we could have done without. The entire programme has not been possible without the support of all who've taken part, given of their time, their expertise, their enthusiasm and their passion. I'd like to hand over to Lena, who will take a few moments to acknowledge our event moderators. Lena.
Thank you very much, Catherine. It is my absolute pleasure to acknowledge all of our contributors to our events, moderators, speakers, and special guests on behalf of FIP and the entire program team. So in the next slide, we'll just show you some pictures of our esteemed and respectful moderators. And I'm just going to quickly go through their names. It really is worth going through each one of them. Thank you to Arit Udo, Ash Sonny, Barbo Holbein, Carlos Lacava, Shima Amadi, Desak Ernawati, Alan Shafatle, Emma Paulino, G. Samalata, and Giovanni Poletti for excellently moderating our 24 events of this program. In the next slide, I'd like to thank our speakers. Thank you to Ian Bates, Jacqueline Surgo. Oh, I'm sorry. Continuing the moderators, actually, Ian Bates, Jacqueline Surgo, John Jackson, Larsak Sutherland, Marwan Akil, Nadia Al-Mazrouai, Nuria Shinshila, Parisa Aslani, Paul Sinclair, Prosper Hiag, Ralph Altieri, Ronald Goose, Ross McKinnon, Sabiha Isaac, Samira Shammas, and Stephanie Cole. Thank you once more. Thank you to our speakers, Ala Hayallah, Alan Dilgut, Alexandra Ruth, Alfonso Cespedes, Ali Joe, Alpana Mer, Andy Shirtcliffe, Colin Pouton, Dalia Dawood, Deborah Goff, Eduardo Savio, Emma Paulino again speaking, Faraz Gilda, Sebua Seljay, Greg Eberhardt, Han Jay, Han Anderson, Helena Rosado, Howard Rice, Andre Trekilkini, Jane Barrett, Jane Hanrahan, Zhao Guedes, John Hertig, George Batista, Kampanar Tuanbutta, Lalith Sinaratna, Leonora O'Brien, Levin Zwenpol, Ligia Alvarez, Lisa Nissen, Louis Bays, Manjiri Garat, Marco Porancajas, Maria Reynoso, Mariella Ferreira, Marianne Sanfournier, Musut Sanchar, Michael Klepser, Mitch Rotholz, and Muhammad An-Nuzali. One more final list of our speakers. Thank you so much to Monica Derek Poix, Nahil Dave, Nikolai Petrovsky, Omotayo Olay, Pamela Logan, Peter Guthrie, Philip Walpola, Rao Vadlamudi, Redwan Suwalmi, Romeo Ongpoi, Ronald Pervenchsi, Ross McKinnon, Samira Shammas, Scarlett Pong, Shane Jackson, Sophia Segura, Walter De Silva, Yagya Nyopain, Yong Pei Shen, Yvonne Iseko, Zaid Kilani, and Ziad Nasur. And a final named thanks to our special esteemed guest from WHO, who Farah has earlier mentioned, contributed to our regional events. So special thanks to our regional officers from the Eastern Mediterranean region, Adil Niserat, from Southeast Asia, Manisha Shridhar, and from Europe, Niazi Shakmak. Thank you very much for all of you for your contributions. Back to you, CD, to the rest of the acknowledgements.
Well, they say it takes an orchestra to play a symphony, and no better person than you, Lena, to acknowledge all of our amazing contributors. I know you and the team have been in touch with all of them so many times, and it's been a lot of hard work, but I just must say, massive thanks to you all. Special thanks to the FIP leadership from my heart, including the President, the FIP Executive Committee, and our Bureau colleagues. Also to our members, including member organisations, our academic institution membership, our pharmaceutical science member organisations, our observer organisations, and the individual members who have contributed to all our sessions. Also to our partners who have supported us throughout this. Special gratitude, I must say, is warranted to our regional pharmaceutical forums and the leadership from the region who have greatly supported us throughout, but especially in this third series. We've had a roller coaster set of events alongside a lot of engagement with our federation and our forums as we work towards greater integration over the coming year. And I thank you all. It's a special moment, really, to acknowledge our sponsor and our supporters from Pfizer. Series 1 and 2 was sponsored by Pfizer, and Series 3 was funded by a charitable donation from Pfizer. We know there that there's a hugely supportive team who advocate for our profession like no others, and special thanks to Diane Thompson and Marcy Yanchunas for their particular support. Thanks to the events team, our marketing communications team, Carola van der Hoof, COO and Congress Director, Mila Turkenberg, our Congress Assistant, who is at present on maternity leave, Daria Van Beek, Marketing Coordinator, Ali Burak-Saman, our Local Project Coordinator, and also to Lin Nam Wang for her support. Especially today, if you look at Twitter, I think we've managed to break Twitter today. So thank you, Lin Nam. Particular thanks to Carleen Ngoma, Programme Coordinator. You've heard from Carleen today. And to Farah Akkad, Projects Coordinator, and you've heard from Farah. And without those two support, we would not be in the place we are today. with particular advice, support and expertise, Gonzalo Sousa Pinto, a program advisor and our lead for practice development transformation. Particular thanks to you. And the most thanks of all to Lina Bada, our program lead for transforming vaccination, for supporting us in the program development, supporting me particularly, and then for ensuring that we delivered the 24 events at breakneck speed before the end of year and set us up with our roadmap for 2021. This slide includes screenshots from all 24 events. Please use your time to thank the audience and attendees on the chat who have made this program possible. Without your engagement and their engagement, we would not have the truly stimulated discussions that we've had. Please remember, colleagues, to visit the website, transformingvaccinationfip.org, to catch up on all the episodes if you've missed them. We will make sure that we keep these, and we will cross-reference to all the guidance that Gonzo has mentioned. We will cross-reference to all the other vaccination events that we have had this year as well. So, colleagues, it's my pleasure to draw this event and the entire programme to a close. I want to say a huge thank you to you, the audience, for your attendance, your participation, your engagement, your support. Here's to an action-packed 2021 filled with delivery of our commitments to transformation. And in the meantime, colleagues, please be safe, please keep well, and let's hope we see each other face to face very soon. Thank you and goodbye.